Chapter 1: Introduction to Factitious Disorder. Have you ever pondered the labyrinth of the human mind, where reality can become a twisted illusion? It's in this complex maze that we encounter factitious disorder, a mental condition that often leaves many of us scratching our heads. Factitious disorder, also known as Munchausen syndrome, is a psychological disorder where an individual feigns illnesses or psychological trauma to draw attention or sympathy. Unlike malingering, where the motivation is often tangible, such as avoiding work or obtaining financial gain, those with factitious disorder are driven by a deep-seated need for attention and care. Chapter 2: Symptoms and Signs of Factitious Disorder. Symptoms of factitious disorder aren't always easy to spot. Those affected are often skilled at mimicking or inducing symptoms of various conditions. They may complain of pain or discomfort, show signs of injury, or even produce test results that indicate an illness. However, these symptoms often seem inconsistent, exaggerated, or unresponsive to standard treatments. Another common sign of factitious disorder is an extensive medical history with no definitive diagnosis. Individuals may frequently switch healthcare providers, often referred to as doctor shopping, to avoid detection. They may also have a history of seeking treatment at numerous hospitals, clinics, or emergency rooms. Chapter 3: Psychological Symptoms and Challenges. Psychological symptoms may also present themselves. These could include dramatic stories about numerous medical problems, vague or inconsistent symptoms, and eagerness for invasive procedures. Individuals with factitious disorder often have an impressive knowledge of medical terminology and diseases, which they use to their advantage. Understanding factitious disorder is like trying to solve a complex puzzle. It's a condition that blurs the line between physical and psychological health, making it one of the most intriguing yet challenging disorders to diagnose and treat. Chapter 4: Summary and Reflection. To summarize, factitious disorder is a psychological condition where individuals pretend to be sick or injured to gain attention or sympathy. The symptoms can range from physical complaints, such as pain or discomfort, to psychological signs, such as an eagerness for invasive procedures or a deep understanding of medical terminology. Remember, those with factitious disorder often have a complex medical history with no definitive diagnosis and may frequently switch doctors or hospitals. It's a fascinating, yet perplexing condition that continues to challenge our understanding of the human mind. So, the next time you find yourself pondering the mysteries of the mind, spare a thought for factitious disorder. It's not just about faking illness, but a desperate cry for help that often goes unnoticed. It's a reminder that mental health is just as important as physical health, and that understanding and compassion can make all the difference.